Everyone, welcome to KHA Homeopathy Study Group Pro Bono Webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different languages. Before we start our webinar, always thank you for giving us this great opportunity. And Dr. Sweta Singh, our Chief Administrator, will start the session.
Hello everyone, myself Dr. Sweta Singh, KHA Chief Administrator, welcomes our respected speakers, Chairman and CEO, Kavita Ma'am, KHA volunteers and all the attendees to KHA webinar. I would like to take the opportunity to introduce KHA Homeopathy Study Group to all of you. KHA Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunor, President and CEO of Kavita Holistic Approach, KHA. This study group is intended to be an offering from Kavita to the homeopaths around the globe. Sharing goodwill and solid clinical work within the classical model are foundational principles for the KA. KA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars which are based on principles of classical homeopathy and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification (CHC) and Achina CPD provider and serves as the associate editor for the Homeopathic Heritage. She is a NASH mentor for North American Society of Homeopaths and lifetime member of NCH, National Center for Homeopathy. She is the recipient of Martha Alman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA, Mr. Harbhajan Singh Cheema, Ex-Director, Homeopathy Government of Uttarakhand and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA Detroit Telugu Association Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. She also received Lifetime Achievement Award 2023 by HomeoCure and Research Institute Director Dr. Rajneesh Kumar Sharma, KA Homeopathy Study Group, Kevin Friendly Foundation in presence of Chief Guest Dr. Shripad Hegde. Best wishes from Homeopathy 360. We're extremely happy and proud that we celebrated 13 years of her book, Beyond the Limit, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality with Kavita, has completed 3 years on 22nd Jan 2025, which was launched in presence of Honorable Guest of Speakers, American Institute of Homeopathy AIH President, Dr. Alex Becker, and Council for Homeopathy CHC President, Dr. Sheetal Tiwari at our KA webinar. At KA's second annual celebration, our Honorable Guest of Speaker, Dr. Johar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities, which we have also listed on the website. Dr. Kavita donated the proceedings of the book through KA Study Group platform to various charitable organizations and homeopathic associations. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, VT Seva, NCH, etc. Interested ones can reach us for details at caststudygroup@gmail.com. As of now, we have over 500 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by me and Dr. Richa Pawar, CA volunteer. It is being recorded as we speak. We will take questions at the end of the webinar, and we will post jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your certificate, and kindly mute yourself and turn your video off for better connections. Disclaimer, all the KA Homeopathy Study Group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinions expressed by our speakers, moderators, and attendees are part of the educational experience and do not necessarily represent the position of the Kavita Holistic Approach, KA or KA Homeopathy Study Group Pro Bono. Thank you. And now let's welcome our honorable speaker, and let me introduce him to all of you. Today we have with us Dr. Krutik Shah, who is an internationally acclaimed physician, researcher, and teacher. He's a chief consultant and medical director at Gujarat State First Private Sri Sai Homeopathic Hospital, Anand. He's postgraduate in Organon of Medicine, and he's postgraduate from International Academy of Classical Homeopathy under Professor George Vitholkas, sir, Greece. He's the main educator at Samuel Hahnemann Academy for Homeopathy, Shah, an academic division of Sri Sai Homeo Hospital. He has received many awards. To name a few, he has received Bharat Gaurav Award at British Parliament, London, UK, and International Homeopathic Healthcare Leadership Award 2019. So let's welcome him to KA platform. He will be speaking on clinical tips to use Dr. Kent's 12 observation in day-to-day practice. Welcome, sir. We are honored to have you, and now you can proceed with your session. Thank you so much.
Yes, Dr. Shweta, thank you very much. It is always a pleasure to be at a platform of Kavita Holistic Approach. And this topic, what I'm going to take is something which is absolutely clinical, derived from experience, and where I should the screen. This topic is purely clinical. It has very limited to do with the So this topic is very clinical. What is mentioned in the Dr. Kent's philosophy is already probably I have taken it on the platform of CAR study group probably previous year in the previous years. This is something which is very clinical. It has very limited to do with what the content theory part written in the book. This is all about sure shots or a kind of mathematical evaluation when a patient is coming to you, and it has practically uh, I would say a way, it is giving a way how you can use Kent's observation in a fastest possible way, even though the varieties of pathologies you may be facing into your practice, right? So this is So this disclaimer already has been read by Dr. Shweta, so I'm not going to repeat it again. Now, what I'm going to share it to you all is something which is very clinical. And this is what I have derived into I have derived from my practice in my journey of almost 20 years having homeopathic hospital as well. All the Kent's 12 observation is divided in three particular parts. Number one is aggravation. Number 2 is amelioration. Number 3 is good new symptoms, or I would say new symptoms. It can be good, it can be bad. So now going to aggravation. Aggravation is basically divided in 3 parts. Number 1 is killer aggravation. Second is long aggravation. Number 3 is short aggravation. We'll be going in detail. I mean to say is in the summary part later on, but this is about an idea. If a patient is coming to you and if patient has aggravation, there are only 3 observations in entire 12 observations list is connected to the case where your mind should go. I want to make it clear here that the role of Kent's 12 observation come into play where your first prescription is acted, where single medicine has been given. There is no Kent's 12 observation on polypharmacy. So your remedy has acted, you have given single remedy following the fundamentals of homeopathy, then only these aphorisms will come into play or these observations will come into play. So with this, it is equally essential to mention here that the knowledge of allopathic diagnosis while giving the first prescription is also very important, because Dr. Samuel Hahnemann embodies the concept of excellent diagnostic skills and excellent homeopathic treatment skills. So he's a combination of wonderful allopath by brain and homeopath by heart, or an allopath by profession and healer as a homeopath by choice. So clinical knowledge to have a proper diagnosis is essential even in this phase as well, in Kent's 12 observation as well. So allopathy, the knowledge of allopathy is essential. It is always understood throughout the lecture where I am talking about Kent's observation. You are not supposed to decide by your own psyche. You are supposed to decide by the strong clinical diagnostic knowledge along with homeopathic treatment evaluation in order to arrive at an accurate judgment. Now, aggravation. As I said, aggravation is divided in 3 parts: killer aggravation, long aggravation, short aggravation. So first is killer observation, that is the killer aggravation, that is Kent's observation number 1. Long aggravation is observation number 2. Short aggravation, quick aggravation is observation number 3. Now this is about aggravation. Now going about amelioration. It is very interesting how Kent's 12 observation has been written, and this is something beautiful when you go deeper into that to realize the fact how what kind of thought process Kent would have been having in his head while writing this book. Now, amelioration is also 3 types. Say for the aggravation was killer aggravation, long aggravation, and short aggravation. So amelioration is also 3 types: simple amelioration, short amelioration, and long amelioration. There is nothing like killer amelioration, right? There is killer aggravation. So there is no killer amelioration. So it is simple amelioration. Simple amelioration is observation 4, where your potency is absolutely perfect, right? Patient needs pulse rate 200 and you're given exactly pulse rate 200. That we will take it out a little bit in detail once we are through with this summary part. Second is about short amelioration. Short amelioration can be seen in acute disease primarily and in chronic disease also. So ultimately, short amelioration is observation number 5 and observation number 6. Observation number 5 deals primarily with chronic disease where the amelioration is short. Observation number 6 deals with acute disease where the amelioration is for hours maximum. In chronic disease, the amelioration can be for days, right? Number 3, long amelioration. This is very interesting. Long amelioration means the remedy is proper but could not create a kind of a very visible similibus curature, what aphorism 282 and 283 is talking about, but full-time amelioration. So it is a long amelioration. So aggravation was killer aggravation, long aggravation, short aggravation. Amelioration is simple amelioration, short amelioration, and long amelioration. And now the third part, new symptoms. New symptoms are also divided in two parts. One is good new symptoms, and second is bad new symptoms. Now, good new symptoms is what we say idiosyncrasy. That is aphorism. That is observation number 8. Some people prove every remedy they get. Idiosyncrasy is a good sign, right? Observation 9 is proving. So it is for prover. Proving good brings good immunity. Proving boost up the health of the prover, provided if it is conducted properly, right? And 11 is old symptom reappear. What we say, Harry's direction of cure. So these are new symptom, but good symptom. If you have these symptoms into your case, it is a good sign. You are in a good situation, good power, good control on the case particularly. And second is bad symptoms. Bad symptoms means new symptoms have arrived after the action of the remedy. Now, the aphorism 104, aphorism 253, 254, and 255 tells very clearly that there are three signs of similimum. Three signs of similimum. Number one is no new symptoms after the administration of the remedy. Second, relief upon the symptoms in which you are prescribed. And third is general signs of well-being. That is, patient's appetite is better, thirst is better, sleep is better. As a result, energy is better. You will be able to see mental well-being. You will be able to see physical well-being. So this is a sign of similimum. Bad new symptoms means new symptoms appear after the action of the remedy. That means you have given a right remedy and you are able to see good new symptoms coming up. So that is a bad sign. And symptom takes wrong direction. That is pure suppression. You are treating a patient of simple recurrent chronic sinusitis, and patient is developing severe heart pathology. Or you are dealing a patient with arthritis and a patient is developing severe kidney disease. This is in total, I can tell you, Kent's 12 observation looks like into your practice. So these three slides, if you have on your desktop, I have these three slides on my desktop. We have three consulting chambers in my hospital for my assistant and my main consulting chamber. All the chambers in total has these three slides. Whenever this patient is coming to you in a follow-up, you just need to watch it. That's all. This is what I am sharing it out with you in my what I have envisioned or experienced in my journey of 20 years of homeopathy career. Because I am basically an organon guy. Organon is the way of my success, is the key of my success. So I can give you short cases, but that cases will be limited to your understanding. So I want to give you the root. I want to give you the key. I want to give you a permanent, authentic, strong, correct way with which you can go ahead. And that will give you a lot of clarity into your practice. Lot of clarity, right? So this is in nutshell. I can tell you about Kent's 12 observation in summary, right? Now we will go into now we'll dive into different types of diseases and how Kent's observation is visualized in a patient sitting in front of you. But before that, I'll be very happy to have feedback from the participants. Am I reachable to you? Are you able to understand me well? We'll be happy to have your feedback in the chat so that I can understand that I'm reachable to you. We'll be happy to have your honest feedback. If you are not agree to me, we'll be happy to receive it. Any honest feedback will always be appreciated. Okay. Now we'll go to Kent's 12 observation in different types of diseases. Now there are serious diseases as well. Pure surgical disease, pseudo surgical disease, but that is what not we are going right now. What we are going is about there are three types of diseases what we usually see into our practice. Number one is acute disease. Number 2 is chronic disease. Number 3 is acute exacerbation of chronic disease. These three are the category. Ideally, we see in our practice as a routine, and that is where your overall. Thank you, Dr. Deepa, for your feedback. So, in these three disease category, your entire practice falls into primarily. That is what I have connected to this observation to the type of disease what we see into our practice. But please make sure that the proper knowledge of allopathic medicine is a must. Proper knowledge of allopathic medicine is an absolute must. Otherwise, you will definitely misguide. You will definitely be misguided. Right now, this is a base with which all the 12 observation will fall into. Acute disease is simple acute disease and serious acute disease, right? Chronic disease, simple chronic disease with only functional changes. Chronic disease with reversible structural changes. And complex disease, you know what is the meaning of complex disease, right? Under lifelong allopathic medication. That is, patient has diabetes, patient has blood pressure, patient has asthma, patient has psoriasis, patient has multiple problems. It is like a museum of the disease, right? Acute exacerbation of chronic disease. That is complex advanced cases with irreversible organ damage. Patient with interstitial lung disease, having lung working only up to 50%. Or a patient of bypass surgery, post CABG developing angina pectoris. Or a patient of cancer developing heart pathology. This kind of situation where the acute diseases will be fatal. Acute exacerbation of the chronic disease will be fatal, right? And intermittent disease. The world is going towards intermittent disease tremendously with great speed, tremendous force. What are intermittent disease? Allergies, stress disorder, migraine, convulsions, chronic. What is the meaning of intermittent disease? Where a patient is normal between the two episodes of the problem, but the acute comes at regular intervals. Say, for example, dysmenorrhea, painful menstruation. But the patient is ill chronically. Patient is having allergy. But patient is ill chronically, though there is an acute exacerbation. Convulsion. A convulsion may come for 2 to 5 minutes, say for. But the patient is ill chronically. So intermittent disease actually falls into a category of chronic disease. But according to aphorism 231 to 244, it is very clearly mentioned that they are a class of chronic disease, but present with acute exacerbation. So this is what I have separated, right? Now, this is a category of the diseases what we usually see into our practice. Now going to the observation. In this first observation, killer aggravation will be only seen in a complex advanced cases with irreversible organ damage having acute exacerbation. Here, your knowledge of allopathic medicines comes into play, what you are supposed to do and what you are not supposed to do. In this case, clinically you will be able to know patient has terminal stage of cancer, patient has blood pressure, patient has diabetes, patient has lost weight remarkably. This is, forget it, you cannot cure it. So this is probably a case where killer aggravation can come. So what you are supposed to do is very simple. Go low and slow. This is in total. Go low and slow. Use LM potency. We are healer and not harmer. So unwanted haste, fast repetition, even though the medicine is right, can land up into disastrous problem, and a patient will end up eventually into allopathic hospitals. So in total, cautiousness is the key. That is what you can say, conscientious homeopath, cautious homeopath, sharp senses, sound senses is the key. If you have these kind of problems, or if you are seeing a case having this kind of chronic diseases in one body, where probably the patient is in the jaws of death or he's not going to survive longer, please be careful. Otherwise, you will end up into killer aggravation. I have experienced killer aggravation in few patients of my practice, and trust me, it is very dangerous to deal with it. One of my patients actually died out of my uh, haste or lack of knowledge or lack of patience, you can say. So this is about first observation. Now going to second observation. Second observation is long aggravation but final and slow improvement. So these kind of cases means long aggravation but final slow improvement. That means the case is curable. Majority of the case is successfully manageable or curable, but they are not going to die. So what kind of cases it can come? Acute disease, simple acute disease, serious acute disease. Long aggravation can be in acute because of low vitality of the patient, where a remedy is correct, but taking time, remedy is taking longer than expected time to show its effect, because homeopathy is not a science of action, it's a science of reaction. Secondary curative reaction. We have given a remedy, we have done our job. Rest we expect from vital force to work for. So in that case, long aggravation is a possibility. Functional disease, chronic disease having functional changes. Long aggravation is expected because of the feeble vitality. Reversible structural damage, very much possible to have a long aggravation. Complex case under allopathic medicines, long aggravation, which is very possible because remedy is probably going so deep to produce a rejuvenation in the organism in order to, there is a possibility to cure of such an incurable case. This aphorism, this observation will not come into play. So if a patient is coming to with long aggravation, but final and slow improvement, if you are observing in a case, these are the only category of disease you are going to see into your practice, right? And what you are supposed to do, it is you just have to have patience. That's all. Just give whatever remedy you have given on the base of totality. Have patience. Your vital force, you will be guided, or the vital force of the patient will guide you towards second or third medicine. And that is where, sound senses, patience, skills of a homeopath, knowledge of a homeopath comes into play. Because in majority of cases, this is a reality. What Kent has mentioned beautifully well is the fact of today. Beginners, upon giving correct medicine, if there is long aggravation, are going into haste, and they are getting confused, they are going into panic, and they start throwing the remedies on the vital force one after the other in order to control the long aggravation. But actually, the truth is the opposite. You just need to wait. You need to be clear by your head. You have to convince to the patient. You have to convey to the patient, and eventually you will find a way towards a magical cure. And this is something, an observation which has good prognosis in total. But here the skills of a homeopath will be tested for sure, right? The observation number 3: aggravation is quick, short, strong, with rapid improvement. Here the vitality is better. Here the vitality of the patient is better. So what can be what can be expected? Acute disease, simple acute, serious acute, simple chronic with only functional, reversible structural, or intermittent. These two will not come, because if the patient is good with vitality, the disease cannot progress at this stage. The disease cannot progress at this stage. So here your recovery is faster. Your effect of the remedy is faster. So your decision making has to be faster. So the previous observation was advising you to wait for the response from the vital force. Here, that is not the case. Here, you'll be able to see with great clarity what kind of case you are heading up to. And by the knowledge of allopathy, only you can come to know where are you, right? In such a case, short aggravation, quick aggravation, maybe for a few hours in an acute, few days in a chronic. But the fact is, vital force is in a good condition, and it can, even though the seemingly incurable case can be curable, and that is the bottom line. There is a possibility that the vital force is pushing the symptoms aggressively towards the surface. As a result, you can see detoxification, externalization, what we say. And externalization is a very common observation, I must tell you, into our practice. There are cases where you can predict externalization can come. And that is what I always tell to my patient if I'm clear. If I'm in doubt also, I will tell my patient that externalization can be a possibility. And there are total 4 points in total, I would say. Number one is case is on the mental emotional level, primarily. Where a lot of ailments, lot of love, disappointment, anger, suppress, grief, sorrows, lot of emotional disturbance. That can be a case of detoxification. Severity of pathology. Severe the pathology, greater is the possibility of extravasation. Extent of medication from the doctors. Usually homeopathy is being chosen out of a hopelessness and despair where all the doctors have been tried and the case has not been come to a solution or a cure. And then patient expect homeopathy to create a magic to make them out of it. Homeopathy can create a magic, but not in all the cases. So in certain cases, yes. In certain cases, partially yes. In few cases, no. But you need to be clear that what are your ways to deal with these kind of cases. Fourth is about suppression. Yesterday only I took a case from London. He's basically a Gujarati boy. His age is 35. He has psoriasis for more than 25 years. And he's taking allopathic medicines ever since he was diagnosed with psoriasis. When I took his case, it was a beautiful lycopodium. So what did I do? I gave lycopodium 6 potent, 6C. Because of strong history of suppression, because of good clarity of totality, good remedy picture, I went very slow because of this problem. And then I explained about these possibilities of detoxification, that is perspiration, respiration, urination, defecation, fever, excess sleep, or weeping. These are the ways which, sorry, these are the ways with which you can clearly explain to your patient about the possibility of extravasation. And this is something which is very needed. Otherwise, if you have not, if your theory is not clear into your practice, or I would say your practical theory is not clear, you are at loss. Trust me, I have seen patients getting spoiled. I've seen cases getting spoiled out of lack of understanding. 80% sorry, 80% of practice is guided by organon primarily. And I must say, major failure of homeopathy practice is because of the negligence of the theory. And this is the hard truth, right? So this is about aggravation. For fourth observation onwards, we'll be going towards amelioration. Friends, can I have your feedback quickly into the chat? We'll be very happy to have your feedback so that I'll be able to understand, am I reachable to you or not? We'll be happy to have your feedback. And please drop your questions also. We'll be answering it out at the end. Thank you, Dr. Deepa. Thank you, Dr. Pragati. Great. Now going towards the other side, the good part, the amelioration part. Now, no aggravation. All the categories of diseases, no aggravation means practically no perceptible aggravation. simple disease, serious disease, only functional, structural, and intermittent. In this category, there will be huge aggravation. This complex advance also has a huge aggravation. So if there is no aggravation, your case falls into the category of 5 diseases. Somewhere you are very clear what you are supposed to do, right? In this case, there is a possibility a case is curable. The patient was needing 200 potency of pulsatilla to make a cure. Vital force was asking pulsatilla 200, and you have given exactly pulsatilla 200. So there is a very limited aggravation, which probably not pursued by the patient, or an aggravation of the state, but not the aggravation of symptoms. And you are able to see straight away the process of cure. We have a problem with centesimal potency that I think I might have discussed earlier. That from 6 potency, we have 12 potency. From 12 to 30, 30 to 200, 200 to 1000, 1000 to 10,000, 10,000 to 50,000, then to CM. Suppose a patient is, the vital force is needing 500 potency of pulsatilla. We have pulsatilla 200, we have pulsatilla 1000. We do not have pulsatilla 500. So if you give pulsatilla 200, the case will not produce or will produce a cure rapid, gentle, and permanent, right? Recovery will be compromised. It will not be rapid. If you go pulsatilla at 1000, you are giving 500 potencies extra to the vital force. As a result, the vital force will suffer with that 500 potency little longer. So this problem, aggravation, unwanted aggravation, was the problem Henneman was facing into his practice. That's why he developed LM potency, where the potency is very close. They are weak potencies. LM potencies are weak potencies. So they can go faster whenever there is a need. You can give 3 times a day, 4 times a day, 10 times a day. It is all up to in our hands. And there is no risk of aggravation also. So this is something. Observation number 4 is exact potency, exact remedy. So this is a textbook cure. You are very lucky, homeopathy, if you get this. But in all the cases, it is not the case. I would say, to be honest, 1 out of 10, hardly you'll be able to see this kind of a cure. But if you are getting it, you should kiss yourself. You should thank God. You should kiss yourself. You should thank yourself that you are able to get this through, right? And as a result, case is on the way of cure with the same medicine, and the patient will forget the doctor once he is out of it permanently. Second possibility is a serious, dangerous, undiagnosed disease. Suppose this patient is coming to you and patient has constipation. You have, and patient has psoriasis, but patient is developing cancer in the body and it is not diagnosed. It is not fully blown. It is not properly exposed to diagnosis or treatment. Somewhere internally patient is developing cancer and you are giving a remedy for psoriasis and constipation. But the same remedy touches the incurable part also. Patient will die peacefully. Even though the case is diagnosed later on, even though the case undergoes treatment also, patient will die peacefully. So no aggravation is 99% curable case. But 1%, there is a possibility that an incurable case is developing inside that is not allowing the vital force to show an aggravation to the surface. But that is very remote possibility. I have seen only 2 patients into my 20 years of journey where I was giving the patient arsenic for bronchial asthma and for migraine. Later on, after 4 months, patient developed liver metastasis. I came to know that patient had a liver metastasis, which probably almost 2.5 years before he would have developed cancer, but they were not, they were asymptomatic. So patient did not consider also that these can be a symptoms, even though patient was arsenic. As you know, arsenic is very health conscious drug, right? So that is a possibility. Next is about ammunition comes first, aggravation comes afterwards. This is a possibility in all the cases, whether it is simple acute, serious acute, functional change, structural change on lifelong allopathic medication, acute exacerbated fatal and intermittent. Observation number 5 is the most frequently seen observation. Out of total 10, total Kent's 12 observations. Out of 12, this is the most common, what we usually see in our practice. But the unfortunate part is we don't realize that this observation is playing. What is the possible condition? This is very clear. Either the remedy is wrong or disease is incurable. Either the remedy acted superficially as a palliative and case is not curable. Remedy was covering good symptoms. It was homeopathic to the case, but could not hold the case in total in order to bring from disease to ease, from disease to cure. So somewhere there is also possibility that the remedy was antidoted. And as a result, there is Kent always says, instead of changing the remedy, one should change the potency. If you see his philosophy, just a minute. Just a second. I think the battery is low. I need to charge. I need to put it in charge. Just a minute. I think I missed my charger at my home, and there is a situation here. I will have to change the laptop. Just a second. Yes, I found it. Yeah, finally got it. I was worried. Thank you. So, so the remedy was superficial, acted as a palliative, or remedy was wrong, case is incurable. Possibility of remedy being antidoted. And it is one of the major reasons why Kent has said that change the potency first before changing the remedy altogether. And that is the bottom line. If you see the later chapters of Kent philosophy, he emphasized this point very strongly, very, very strongly. Right? Next, obstacle in the way of recovery. This is fifth observation. I can tell you with certainty that if you look in your cases, almost 80% of your own practice entirely falls into fifth observation. And that is something huge. That is where we need to be focused upon, right? Possible solution is re-examine the case, go in detail, and evaluate. If the patient is under the same totality with little modification of symptom, raise the potency. But don't change the remedy faster if you do not have good PQRS, if you do not have good totality, or if you do not have good symptoms in total, whether mental general, physical general, ailments from whatever. But this is something which is very essential, right? So this fifth observation is practically a heart of all the 12 observations in total, I can tell you. Possibility what we are supposed to do is clear. First prescription was superficial. If the case is curable, with your own knowledge, you are able to see that the case is curable. Go to the case again, review, change the remedy, give another prescription. And the first prescription, which boosted the immunity of the person, which modified the vital force, which empower the vital force with the partial similar, will give you good new symptom for good second or third prescription. Usually, this is a case clearly you can judge by the knowledge of allopathic medicine. You're dealing a case with cancer or deep psychiatric problem or a case having museum disease, you are not going to cure it. This is something more or less you have to change the remedy, you have to change the remedy, you have to change the remedy. But if a case is curable, you will be able to see good PQRS in the second prescription. Third prescription will be even better, and fourth will cure the case. So this is in nutshell. I can tell you about fifth observation. Sixth is about primarily this is about acute, right? It is primarily about acute. It can work for chronic also, but primarily is about acute. Too short relief of the symptoms. That is acute. You have given 30 potency where a patient needs 200 potency. Here you need 10 m where you have given 1 m. Functional disease, you need faster repetition. You gave one dose and waited. Reversible pathology, fast repetition, you miss to repeat. Lifelong allopathic medication is not allowing the simillimum to go deep into the energy complex or the deeper into the vital force to produce a good reaction. So there is superficial relief. And as a result, what happens is that somewhere you feel that the case is not going further. But these are the possible situations. In total, I can tell you, is that in acute case, serious pathology you are dealing. Because remedy is getting exhausted faster. In my practice, I can tell you, whatever acute I see, out of experience, I have observed that 1 m works best. Initially, I used to give 30 potency. Then I had a fear in my head that the remedy is correct or not, potency is right or wrong. The disease used to progress faster. Then I observed on 200. Same situation. 1 m works like a magic. So in acute case, if I see in my practice, I prefer to go on 1 m. It is not prejudice. It is out of experience, right? Chronic, look for obstacles, advanced pathologies. Serious pathology, irreversible structural change, low potency, remedy antidoted, obstacle, strong allopathic drugs like steroids, hormonal drugs. Usually in total, if there is too short relief of the symptoms, make sure that you repeat the remedy again and again, faster and faster. Otherwise, you might miss the correct medicine out of lack of knowledge, lack of repetition, right? Seventh observation. This is something which is for serious chronic diseases, completely opposite to six, where a patient is having complex disease on lifelong medication, serious pathologies, where you are going towards this kind of disease, you will not be able to find a magical textbook level of improvement. You will find amelioration. Patient is better, but no special relief. Special relief means mental emotional well-being, general's well-being, beautiful effect of the remedy, a magical effect, dramatic textbook cures. What we usually see in observation number 4. This is not going to happen because of the reason that cases are complex under strong allopathic medication or lifelong allopathic medication. Number 2 is complex adverse disease with irreversible organ damage and acute exacerbation. These are the cases you will see improvement, but no special relief. Special means signs of simillimum will not be that fully seen. Here, what is the in total a need you are supposed to do is repeat the remedy faster, repeat the remedy faster. Probably you have touched the first layer, second layer will be deeper, third layer will be deeper, fourth layer will be deeper, will create a cure. Nowadays, friends, single remedy magical cures is not possible because our health has gone so down. You need multiple remedies to rejuvenate the organism. So general science of well-being is missing in cases which are under strong allopathic medicines for complex disease. As I said, patient has chronic psoriasis, patient has chronic migraine, patient has chronic bronchial asthma, patient has chronic constipation, and he is coming to you with lot of stress, you are not going to see a magical cure. So, and over and above to that, the same patient is under chronic allopathic medication. This observation is likely a case, right? Now, going to in the sorry, this I missed to tell here something very important. Latent situation where patient is coming to you with only one kidney, where first the other kidney was diseased, for example, childhood nephroblastoma or a kind of a tumor, patient is living on only one kidney. Or patient with interstitial lung disease, he is 40% of lung is only working, 60% not working. There is permanent damage, gross damage. You will not be able to see a spatial relief. And these kind of cases are only curable to a certain extent, cannot go beyond. Remedy is correct, but patient will not be cured and can never be cured. This can be palliated, for instance, but it is not possible to produce a magical textbook kind of cure. This is not possible, and that you can straight away come to know when you see a case with your knowledge of allopathic medicine, when you see a case with a knowledge of clinical diagnosis, right? Observation number 8. Now, from 8 till 12, as mentioned in the earlier part of the lecture, this is now about symptoms. It is not possible to define these 5 observations into disease category because this is about symptoms. You cannot say proving cannot happen in acute, proving cannot happen in chronic, proving cannot happen in acute exacerbation of chronic, old symptom cannot come in acute, old symptom cannot come in chronic, old symptom cannot come in acute exacerbation of chronic. These 8 to 12 observation is open for all, open for all. So it is difficult to segregate which category of disease patient, acute disease, chronic disease, acute exacerbation of chronic disease fits into this category, right? So some patients prove every remedy they can. As I said, these are good symptoms, good new symptoms. Idiosyncrasy. Some patient proves every remedy can. That is pure idiosyncrasy. Well, it is a 117 aphorism. The 117 and 119. This is something which is an inherent constitutional quality. You cannot change it. So whatever remedy you give, people will develop that remedy symptoms. I had a homeopathic student who was idiosyncratic, but I was not aware. So first remedy I gave sulfur, he came up with skin eruption. So I thought the remedy is wrong. Then I gave pulsatilla. Following a thorough evaluation, he developed symptoms of pulsatilla. I said, what is happening? Then again, upon a re-evaluation, I gave him lycopodium. It's the patient developed symptoms of lycopodium. This is so horrible. So then I told him that I'm not supposed to see you. Either I can treat you with LM potency, or you have to have, you should not go more than 6 potency or 30 potency in centesimal scale if at all you want to get my treatment. And then the treatment span will be longer than expected. So this is idiosyncrasy. Then is about when a patient is coming to you with homeopath who are throwing polypharmacy to the vital force, multiple medicines at a time, multiple medicines at a time, combinations, mother tinctures, Suzler biosalt, potencies, multiple potencies of different remedies. This is gross compromise of the principles. You can get this kind of picture. I had a case who is a fashion designer here. She was under a homeopathic care of a senior doctor who was also one who was my teacher in my bachelor degree. She was his patient for more than 20 years down the line. And when I saw her, because of some reasons, she changed the doctor. And when I saw her, I was able to see half of the mater medica in her. Half of the mater medica. I was able to see keynotes of sulfur, pulsatilla, natramur, bryonia, calcarea, naxomica, rustox. I said, what is happening? What I did, I straight away put the patient on placebo. Trust me, after 1 month time, patient was better 20%. After 2 months, patient was better up to 40%. Within 6 months, her 80% symptoms were gone. And then I was so sure that this is a case of calcarea with 30 potency, only 3 to 4 doses, patient is cured totally. So this is also a situation where the main reason for a patient to change that doctor who stopped the treatment of my teacher was that in spite of taking his medicines, I was not getting cured. I was getting new more diseases. His medicine is not working in my health. So I'm getting more diseases. I'm not improved. I'm worsened. But actually, the medicine was creating diseases. They were iatrogenic diseases. Of course, we are not supposed to say this, but I was clearly uh, understood that what is the situation. Placebo was the best prescription in that case, made a permanent magical cure with a few doses of calcarea. Right? Observation number 9: action upon the provers. This is a good sign, right? Proving is always good. It increases the health. It increases the health. It is like homeopathic prophylaxis. It is very good in total. So proving is always a good sign. One of the doctor I know, her name is Dr. Chetna Shukla from Bombay. She does proving. She has made tremendous contribution in proving of the remedies. When I met her last week, I was amazed. The way of health she has, the way of work she's doing, the way of capacity she has, the way of understanding towards human mind or life she has. Amazing. So proving brings good health in total. In total, right? Number 10, new symptom appear after the remedy. That is a wrong sign. As I said, 104 aphorism, 253 aphorism, 254 aphorism, 255 aphorism. 3 signs of similimum. No new symptoms. Relief upon the symptoms upon which you prescribe. And generals should be better. So no new symptoms was the first point. Here, there are multiple new symptoms coming up. Great number of new symptoms following the administration of the remedy. Prescription is unfavorable. The remedy is wrong. So as a result, this is something which is wrong prescription. It is a bad new symptoms coming in a case, right? 11, old symptoms reappear. This is a beautiful sign. What you can say, Hering's direction of cure. Above, downward, within, outward, more to less important organ, reverse order. This is reverse order. It is a good reaction. If you have a case coming up with old symptoms coming back, you should thank yourself that you've given a best prescription. Don't touch the patient. Don't repeat the medicine. Let the patient be on placebo maximum the patient can, because it is the best reaction what a vital force is able to produce. And as a result, the patient is in a stage of curability. He's on a way of cure. If you push with more potency, more repetition, you will end up into accident. You will end up into aggravation. You will spoil the case. So in this case, nothing should be given. Only wait, only placebo, only counseling, only motivation, only love, care, and support, only constant tender touch. That's all, right? And the last, it's 12th observation. Symptoms take wrong direction, which is also a very bad sign, because ultimately your patient is coming to you for joint problem and developing violent cardiac problems, where problem from periphery push to center. This is a wrong sign. This is great dangerous sign. If you There is a very limited possibility to antidote the remedy homeopathically. Ideally, conscientious homeopathy will never need to antidote according to 257 aphorism and 259 aphorism. What Henneman talks, conscientious homeopathy will never in a situation to need an antidote, to give an antidote. I never had I don't remember even a single case of my career when I need to antidote the remedy. So remedy selected was wrong, probably only on external symptoms. Like for eczema, take sulfur. For coryza, take LM-Cepa. For migraine, take belladonna. For constipation, take bryonia. This is a very superficial drug, but superficial disease, and patient comes up with serious vital organ problems. You need to antidote the remedy, otherwise the case will badly compromised and will be jeopardized for his health also. And you are developing a disease to a new location, new vital area. As a here, either you need to immediately antidote the effect of the medicine, and if you have a good hold on the case, remedy should be changed immediately. Right? Last but not the least, what I can tell you in total is about these are the observations which I have a homeopathic hospital where I make indoors also. I treat patients of high grade fevers, pneumonias, convulsions, appendicitis, colics, asthmas, lot of acute I am dealing with. And I'm very happy treating those kind of patients, right? These are the observation. That is observation number 1, 3, 4, 5, 6, 10, and 12. You must have in your head. I would say my entire journey of homeopathy practice, as mentioned earlier also, is guided by organon. When I see a case, I don't, when I'm listening to the symptoms of the patients, usually the mind of a homeopath goes towards the possible similimum, possible remedy, possible prescription in a case. My mind goes towards the aphorisms. Which aphorism is working here? Which aphorism is applicable here? Which aphorism will come to rescue? So for me, taking a case is organon. Then using the logic, organ is logic. Using the logic properly, I go to Matremedica, I go to repertory, and in total, I give a prescription. Because organ is logic. Which symptom is important, which symptom is not important is logic. However, vital force is responding to a case is also logic. So without logic, you cannot solve the case. And there is a big problem with homeopaths now is they don't value organon. Only on Matremedica and repertory will give you a success, but to a very limited stage. Using organon will give you a success like a sky high. You will be world famous in a very short time, but you need to understand it once but properly. With this, I close my talk. I thank you everyone for your patient listening. And if you wish to write to me, you can write at this email address. I have a homeopathic hospital here in the state of Gujarat. If you wish to visit, you're welcome. And I have an e-learning, which is the only e-learning in the world which is giving education exclusive in the subject of organopedicine. It is the only e-learning program in the world which teaches only organ, no repertory, no mathematics, primary. Because I'm on a mission to redefine organon. Without organon, homeopathy cannot live on the planet. So I will be very happy if you can visit this website, search for about if you like courses, you can buy it, or else give us your feedback. We'll be happy to work upon it. With this, thank you very much to Dr. Kavita ma'am and the entire management committee. And I want to thank Dr. Shweta also for taking pains to arrange this webinar and to moderate as well. Thank you very much.
Thank you so much, sir. It was a really enlightening session. And now moving towards our second speaker, I welcome Dr. Deepa Rajenimbalkar, who is associated with us as a volunteer. She is BHMS from Bharati Vidyapeeth Homeopathic Medical College, Pune in 2004, MD from Sonaji Rao Homeopathic Medical College in 2008, SCPH course by Predictive Homeopathy and International Center for Homeopathic Medicine, PG Diploma in Counseling and Spiritual Health from Annamalai University, PGNAH from National Academy of Homeopathy, Nagpur. She is the author of book Panchakosha, Homeopathy is divine science, and Vice President of Karnataka Qualified Homeopathic Doctors Association, Bangalore. She is a branch head and senior doctor at Positive Homeopathy Clinic and Indiranagar, Bangalore, and practiced at DRDO Scientist Hostel Homeopathic Clinic, presented numerous scientific papers and author of many research articles. She was awarded with many awards and uh, to name a few, Young Achiever Award 2021 from Institute of Scholars, Kavita Holistic Approach Best Volunteer 2020, and Young Researcher Award 2023. So welcome, Dr. Deepa. And she'll be speaking on compassionate healing and enhancing longevity with homeopathy for seniors. Welcome, Dr. Deepa, to CAR platform. Am I audible?
Yes, yes, doctor, you're audible.
Welcome, ma'am, and please proceed with your session. Thank you.
Yeah. My PPT is visible.
Not yet.
Yes, now, Dr. Shweta, I'm visible. My PPT is visible.
No, ma'am.
No.
Please share again.
Okay. Okay.
It is visible now.
Yes, yes, yes.
Can you please make it full screen?
Yeah. I think it's not view. I'm going to view, but it's not happening, doctor.
Doctor,
Yes, sir. Shall we go ahead, Dr. Shweta, like this only? I think I'm not able to.
Can you please click the icon that is, at the
I'm doing
bottom?
that, but still it's not. I'm making that view. Okay.
Okay.
Okay. Okay. Okay. All good. So I'm audible, I am visible, and my slides are there. All good.
see at the bottom to the notes. You'll be you can click Shift F5 if in that case.
Okay. It's working.
No, ma'am.
Okay. I think we will go ahead. I don't just, this is my new laptop just now, like 1 month old.
No, at the bottom there is an icon, ma'am.
Okay.
If you
Yeah, yeah. Fine.
Yes, now it's fine. Yes, yes. Please go ahead.
Correct, correct, correct. Okay, okay, okay. Thank you. Thank you, Dr. Krutik. Thank you, Dr. Shweta. Yeah. Warm greetings to all delegates and very happy Ram Navami. I'm honored to share this platform with estimated Dr. Krutik Shah sir. My heartfelt thanks to Dr. Kavita for the wonderful opportunity. Her guidance is truly inspiring. A special mention to Dr. Shweta, our Chief Administrator, for her continuous support and gratitude and dedicated KA teammates. Welcome all once again, and let's make this session truly enriching. So, here it is. Dear friends, compassionate healing and enhancing longevity with homeopathy for seniors. Though I am MD and PhD in a pediatric, but today's my presentation is on senior, on elderly people. So, a heartful dedication, honoring all elderly patients. These are all my patients, and they all are 70 plus, in fact, 75. So, my this presentation is dedicated to them. So, nurturing wellness, homeopathy for infants, adults, and the elderly. So, here are like you can see 5 generations. This is the oldest lady is great grandmother. Then the lady with the sari is a grandmother, mother to this. She's my mother to this young homeopath. And you can see the two kids, my two twins, tiny twins. You can see they are two, one girl and boy. So like this, like infants, adults, elderly, one, two, three, four. 4 generations are in this one picture, homeopathy for all and enhancing the longevity. So, a gentle approach for elderly care. Homeopathy is holistic medical system based on principle of like yours, like the basic introduction. We will go. So, benefits for seniors, safe and gentle, supports chronic conditions, boost mental well-being, personalized treatment. So common remedies for seniors. See, usually it happens if you are going and visiting any place or anywhere, and then you introduce yourself. I am a homeopath. I'm a practicing. Then they say, please give us something. Why can't you give us? Or you write a prescription, and we will go to pharmacy. We will take. So I'm just giving a safe medicines. Safe, very safe. You can prescribe them. Arnica, Naxvomica, Calcarea carp, and Ignatia. Arnica for pain relief and recovery from injuries. Naxvomica helps with digestion and discomfort from medications. Calcarea carp supports bone health and vitality. Ignatia eases grief and emotional distress. Usually old lady female coming and just she's so moody and she's telling all, so you can easily give these medicines. So usually what happens, one case, one more case, and you become a family doctor. So usually my journey happens like parents are coming with a pediatric case, maybe allergic skin problem, autism, any like repeated frequent. So they come, they take a homeopathic medicine, then they say, doctor, you treat me. That is the wife or mother. Then you treat my husband, and then they say, can you treat my mother or my mother grand? So you can't say no. So like this, you become one case, one more case, and you become a family doctor. So today I'm going to share a case, a very nice case. So usually you can see, hello ma'am, I am my medicines for psoriasis is over. When should I call you for the video consultation? And hello ma'am, when can I call you? I need your appointment to talk about my mother's health. So this is what, so I said, okay, like first this patient's, the child was better with eczema. The child is doing better with eczema. Then he himself was better with psoriasis. And now he want his mother to, I said, okay, fine. You can send me the reports. We will see what my mom blood report from 26th March 2021. So like this was like during the COVID times. And what was the case? What was the case? A senior case, a comprehensive care approach. Now, here it begins, a comprehensive care approach for a senior female with gallstones and cardiac pacemaker dependency. So they have, I said, okay, I will go ahead. Already 2 generation I am treating. And here is the discharge summary. I will just like the date of admission was on 5th 12 2019 and date of discharge was 9/12 2019. And chief complaints were paroxysmal atrial fibrillation reverted to sinus rhythm, mild LV systole dysfunction, EF 48%, hypertension, hypothyroidism, allergic bronchitis, OSA, and complaints of breathlessness on exertion since 1 week, complaints of decreased sleep, decreased urine output since 1 day. So this was like uh, all we are going through the reports of the patient. And so same what I read you, that report is here. Just follow the dates. So this was her past history. This was one episode which has happened in 2019. You can see the date also. In 2019, this has happened. And after that episode, soon after that episode, the patient was under the surgery and they have given permanent pacemaker implantation for this. So I will zoom it. So but this was in 2021 and one episode was happened. That was a date of discharge 9/12/2019. Chief complaint at that time was paroxysmal atrial fibrillation reverted to sinus rhythm, mild LV systole dysfunction, hypertension, hypothyroidism, allergic bronchitis, obstructive sleep apnea. This was a past history. Then they have done pacemaker implantation. And 13th April 2021, see, 2nd April, pacemaker implantation was done. 13th April 2021, complaint of a pain in abdomen. So they have done all this one more report, and then they were like it was acute pancreatitis, acute cholecystitis, and fatty liver. So 3 episodes. This old lady is getting admitted frequently, and now they have visited you for her disease condition and her frequent admission to the hospital. Even that the daughter-in-law is not staying with her because by seeing this old lady is getting admitted frequently, she even took off her son, and now only the patient, her son and patient is staying. So the diagnosis was gallbladder calculus. And the lady, this was a video consultation because so many restrictions were there for a female who is having a pacemaker. This much water intake, this much, she can't move so much. So many restrictions were there. And now she is telling, मैडम मेरी पथरी ठीक कर दो, कैसे भी करके हमको पथरी आई है, हमारी पथरी बस आप ठीक कर दो. That was her case. She is so complained of, like we started in the all this happened pacemaker April, and one more episode May 2021 we started with a complaint loss of appetite, incomplete sleep, difficulty to pass motion. Through her tears, she recounted the sorrowful news of her husband passing and mentioned how frequent hospital visits had led her daughter-in-law to leave home, all while speaking with understanding and without any criticism towards her. She was like her husband was passed out, and according to her son, she is a gentlewoman who has never scolded or raised a hand against him or his brother during the childhood days. The history what the son has given to me is like that. And even like her daughter-in-law has left her, the daughter-in-law is not leaving, but she has not spoken a single word against her. She just said, madam, she left विथ लॉट ऑफ अंडरस्टैंडिंग एंड ऑल. हम इतना बीमार हो रहे हैं, वो हमको बच्चा को लेके चली गई है, हम हमारा बेटे के साथ यहाँ रह रहे. दैट व्हाट शी हैज नैरेटेड टू मी. सो दिस वाज द केस. सो ट्रीटमेंट seeing on this, calcarea carb 200 started, 400 pills, 1 gram morning and evening, low fat, less spicy diet, small frequent meals, and stop milk. So along with our medicine, this strictly milk she was taking, some quantity of milk, like for a pacemaker patient, they are supposed to drink this much water. So they are including milk in their diet. So completely milk was stopped. Advise her to take a walk in drawing room at a slow pace and duration her own comfort and capacity, ensuring the space is safe and free from obstacle. Just she can walk from little bit within her drawing room or where little bit walking. Avoid close contact with devices that generate strong magnetic fields, MRI machine, powerful. Keep mobile phones and other wireless devices at least 15 centimeters, 6 inches away from the pacemaker side. So advised along with our medicine, strictly this was advised. 5th September 2021, improvement was there, appetite was good, still motion was, constipation was there. So again, the remedy here, we started with Calcarea Carb 204 pills, Chelidonium 34 pills afternoon, Nux vomica 204 pills in the night. Milk and milk products completely stopped. Walking small steps at home is continuing. But again, after doing this also, giving this much remedy because she want to relieve her constipation, and Nux vomica was given, Chelidonium, a specific remedy for her gallbladder stones, and Calcarea carb, her constitutional. Even after doing this, they underwent to the investigation. So first investigation report came in the month of May, and now the another report came on 12/10/2021, almost like 6 months. So because they were also, the son is also very much aware, and he also want to know what exactly is happening. So I advise go for 6 months. So after 6 months, so almost the things were same. Gallbladder calculus was there, and some cortical cyst was also there. They said we are not worried about cyst as per their expert doctors, but stone is a matter of a concern. Possibly in future surgery can be required for this. So that was the word of caution given from the experts. So October 2021, after report, Calcarea Carb 204 pills were given. Here now, Thuja 1M, the intercurrent after the report, after the 6 month of the medicine, the calculus were there. So now the miasmatic Thuja 1M 4 pills were given. Though now constipation is much better, patient is taking Nux vomica 200 as per required. So now Nux vomica has become as per the SOS. Like to next day morning, if the motions are clear, she will, night time she will not take the Nux vomica. The son is taking care. Advice to maintain the food timing for frequent meals. So she was like not able to understand what is frequent meal. Her son is also not able to how to. So they advise to eat every 2 hours. Now after this son is at a Bangalore. The report is almost same, and now the patient is going to another son. Patient is going to native. So why the, if you see the title compassionate, so we can't now withdraw, or we can't say no. You are going. You are not somehow. You're not how we will monitor what will happen if any emergency, or what will, we can't be in a panic or any anxiety. So they were like, see, now she is going, I am here. So now we have given a medicine for 3 months. We are giving medicine with a full faith, with a full confidence. Her symptoms wise, she is better. Constipation is relieved. Till that time, like from 6 months, if you see the, even the report, gallbladder calculus is the same, but 6 months, no emergency, or she's not admitted in a hospital. She is maintaining, she's taking medicine regularly. She's following everything what you have told. She's doing walk. So as a physician, keep a patient, I keep a patience, and 3 month medicine I have given. Calcarea Carb 200, 4 pills in the morning, Thuja 1M, 4 pills in the afternoon, and Cheludinium 30, 4 pills in the evening. And Nux vomica she is taking as per required. 4th Feb 2021, patient, another son native, contacted after 3 months. So see how the follow-up. They have went to the native and she is much better, appetite good, motion good, sleeping well, walking in a drawing room, no medical emergency till now. But she is complaining of a backache. Now backache is there. How? Now we can't say ki she's an old lady and backache and we just relieve. Okay, we have to treat what she is telling. We have to treat for that. So calcarea carb 204 pills and rustox 204 pills, taken medicine for 3 months. These medicines were given for 3 months. Usually that's what the native son feels. Madam, we will communicate with you after 3 months. I said, okay, fine. It's your wish. No worries. You want. The thing is, you have given the Bangalore son 3 months medicine. So the native son also is telling, we will also communicate with you after 3 months. I said, fine. Okay. No worries. You go ahead, but just maintain a food habit. Make her walk little bit in a room. So as UHG done April, patient Bangalore son in now again they are planning to go for regular checkup. So my now the patient will come back to Bangalore for her regular investigation, her regular reports. And here is the no evidence of gallbladder. No evidence of, you can see in the report of 4/4/2022. The no evidence of calculus in gallbladder lumen. Cortical cyst were there. Fatty infiltration of liver grade 1 is there, but calculus is not there. They were like very, very happy with this report. The report is done, and within this span, the calculus is not there. And whatever the pacemaker is there and all things, the experts are also happy with her, and no emergencies. From the time she's taking homeo medicine, there is a no emergency. She's living her life well, very well. She is enjoying her life. Again, they have done the investigation report. This one more they have done pacemaker to see what is the condition of a pacemaker. Cardiomegaly, left CP angle blunted, pacemaker device in a setu. It is a like, and please correlate clinically. All investigations were done during that time. This was the report. One more report they have done. There also like uh, some renal cortical cyst were there, congestive hepatomegaly, but no calculi. Report 15/8/2024 they have done. 4/4/2022 and 15/8 UHG report. GB wall thickness appears normal, lumen is echo-free. So absolutely the report came no gallbladder stone. So this is how, and she is very confident. The son, both the son from Bangalore son also and the native son, Madam Patri chali gai, gallbladder stone is not there at all. No need to worry. Now 30/12/2024, she said, Madam, I am having arm pain. Both arm pains are there. Like this is the from the journey 2021 to 2025, 5 years of a follow-up with no medical emergencies. This lady is living her life very well. And even her gallbladder stone, it's a no, the reports are showing normal, no calculus. So even for small, like some backache is also not there. Only some arm pains, like she's lifting her hand up and wearing some clothes, and she's wearing sari. So arm pain, and she is also having a history of a fall. So Aranika was given to her. So this is what we have done, the complete follow-up. The thing started 2021 to 2025. Recently, I gave them a call. They said, Madam, she is all well. She is doing well. And simple remedies, if like Nux vomica is not required, Rustox is also not required. And we have given her Arnica and she is doing well. No at what we have achieved. See, there is no with compassion, with lot of compassion, we have treating no medical emergency, small things, everything is going. She is long living her life in a well way, her life without any more problem, or and we are giving safe medicine, simple medicine, because how the things are happening, the for youngsters the life is fast, the life is uh, frequent hospital visit could be a problem. So we are treating with a very simple medicine with a very good result, minimal no side effects. And if we see, it is a case of a pacemaker implantation and gallbladder stone. So this is what now we will go to the next case. So she is a German lady, Indian lady, and she used to teach uh, Sanskrit in German language. She has done her PhD. So she has one function. She visited my clinic, and she was having a case of she was having a milk allergy. So very positive personality, very enthusiastic, and very much love for homeopathy. For her pets also she gives homeopathic medicine. So, a journey of a healing, a tribute to a remarkable woman. Her case was discussed in my book Panchakosh also. Small write up is there for this lady, this 75-year. So, photo might be not there, but she is one very inspiring lady, Mrs. Joshi, Dr. Sulochana Joshi. Usually, we should not tell the names, but extraordinary female. A former professor in German, she holds a PhD in Sanskrit and dedicated her life to teaching the beauty of Sanskrit language to German students, bridging cultures with her wisdom and passion. Her deep understanding of homeopath philosophy only added to the remarkable depth of her and intellectual and personal pursuit. For years, she grappled with a severe milk allergy, consulting numerous homeopathic doctors in search of a relief. Her journey took a transformative turn with the administration of tuberculinum 1M and arsenic album 200. Considering her past history of bone tuberculosis, these remedies work synergetically to address both her chronic condition and her allergy. In past history, she said when she was at Germany, she suffered with tuberculosis. But now, at present, she was absolutely well. Still, considering the past history, tuberculinum 1M was prescribed along with arsenic album, and she is doing absolutely well. Thanks to this meticulous and thoughtful treatment, she has not only overcome her milk allergy but also regained her, so she is able to enjoy her cold coffee. That's how we used to discuss. She will call, she will just ask, these 3, 4, 5, 6 remedies are there in my mind, doctor. Which remedy will you select? You tell me. These 5, 6 remedies are coming for particular anything, and then accordingly she will prescribe to her pet, or even she will prescribe to another but this past history she was not considering for herself, and tuberculinum really helped her. This is the case, a case of a trigger finger inflammation in tendons causing fingers to lock in a bent position. Ruta 204 pills has helped. So see, you can just look at her and you will see what is her age. You can see she's 80 plus lady, but she walked my clinic. She came by walking. Every her grandchildren, they were doing job. They are not taking her pains or anything seriously. They were simply laughing. Her son told, Madam, we have done all the report. This lady is fine, absolutely fine. Only some deficiencies were there. Vitamin D deficiencies were there. So we have given her medicine, only no dentition, everything, all her reports are fine. But she's telling pain is there. So we have to give medicine. You have to become compassionate towards them. Give them our simple remedies. That will really help them. Even this healing bone and bondage, now this article we have just published in newsletter. So this lady was absolutely doing well. One more case, see, this old people will have a problem with the outward bending. You can see a photo. The outward bending of the big toe in elderly females is most commonly diagnosed as hallux valgus, which leads to formation of benoin. This condition involves a deviation of a big toe towards second toe, causing bony bump to develop a base. So many like these cases, and the pain will be very high for them, unbearable. And they keep talking about pain, and what the people around them, maybe they are not bad. Their relatives, their son, their daughter-in-law, their grandchildren, they are not bad. But that frequent, we are in a pain, we are pain. Why they are always telling like this? They are in a pain. Why they are? But when if the elderly people are coming to you, be compassionate towards them, give them a simple remedy, give them, advise them for a simple good tips like wearing a soft chappal or something. Just see at their home granite is there or mulberry is there. Advise them to wear the slippers at home. Give them simple remedies. So this the many cases will come to you with, and you can give very nice result. See, we now this is we can't reverse the pathology. It's a structural irreversible cases, but surely we can give them a relief. The pain will be less for them. So possible causes for this are age related changes, arthritis, genetic, ill fitting footwear, that also you have to rule out, pain or soreness, the big joint swelling, difficulty wearing shoes due to discomfort. They can't see, they can't wear the sport shoes, they can't go for walk. They are enthusiastic, energetic with their stick, they want to walk in garden, in their apartment garden. But with that toe, wearing good quality of shoes or anything become difficult, so they can't walk. So you have to give some relief to them. So differential diagnosis and many case studies are there. The remedies for this kind of condition is a calcarea fluor rust tox hypericum. Depending on what totality is coming, you can give. This lady was given a calcarea fluor with a very good result. So she was in very, very much pain. You can see her foot. So we are not able to make changes in the foot, but surely the pain will be relieved. So again, usually now I told you, you're a doctor for a family, and now a family doctor, they will call you for your function. They will call you for, uh, so usually this lady is my patient and this Babuji is not my patient because he is absolutely well. He's doing absolutely fine. This patient is not, this person is not having any health issues. He is maintaining a very good lifestyle. And this lady, simple cough, so rheumax, and she had a fracture. I went to her home. She was just lying. I have given, she used to visit every month, taking her medicine, full case is there. And for fracture, I have given symphytum for her. And her cough was not getting better with any medication. So many cough syrups, Ayurvedic cough syrup, allopathic cough syrup, even tulsi kada, so many home remedies. But Rumex 200 helped her. So she is able to do her daily chanting, or if she visits somewhere, then she is able to. And this person, one day, just he will accompany her, and he said, I am having this small joint pain, doctor. Can you do something for this wrist pain? It's not I'm applying coconut oil, I'm applying Jhindu balm, I'm doing this. Painkiller usually I don't take, but sometime but it's a short relief. Can you give? So, small remedy, Actia spicata, helped. He's completely relieved the symptom. This man was absolutely fine. This Babuji was doing absolutely well, and they referred many patients to me. This couple referred many patients to me. Simple remedies, very good result, and good for you, good for them. Everyone is in a good, happy mood. So, Actia spicata indication is in a cold, damp weather. Wonderful remedies we are having, useful for joint pain. Other remedies could be Rustox, Bryonia, Apis causticum. That also, and little past history or family history or anything you can give, treat accordingly. So now the hallmark of health is one journal. There now they are studying so many factors about aging. So they have come up with the you can just go to the Google and see this hallmark of health sale journal article. So they have come up with concepts like spatial compart homostasis maintenance, stress response, adding psychosocial dimension to this. So these are the you can see integrity of barriers. Very good article they have done. Recently, the seminar also happened in Bangalore. The many Dr. Brand Kennedy, Madhuri Dixit, her husband Dr. Nene, many Nikhil Kamath, many visited because they are doing the research on all this aging and so we as a homeopaths need to come up and show our cases, our result, what we can do in aging for the senior members. The theme for this web seminar conference is Longevity India Rise for Healthy Aging. The Longevity India Rise for Healthy Aging Conference 2025 focus on aging science, policy, public health, research, innovation. So key was this article. Cell Journal, very good article. And even you can see the Longevity India Rise for Healthy Aging. These two things surely you see for it. Pillars of health, very simple. Keep it easy, keep it simple. Maintain a good lifestyle. 6 factors: sunlight, diet, good air, exercise, rest, and mental health. Longevity, when we are talking about longevity, the natural resources, we need to do this. Keep your face always towards the sunshine and shadows will fall behind you. Diet, let food be thy medicine and medicine by thy food. Fresh air is the elixir of life. Breathe deeply and embrace vitality. The body achieves what the mind believes. Move and world moves you. Rest, a good laugh and long sleep are two best cure for anything. Mental health, what conversion, so mole social mixing. So these are some stories. So we will start from left. So they are like meditation group Anand Sangha, Bangalore, all senior member. So this lady was treated with petroleum. She was having nausea. We were doing travel. So she said, I'm having nausea. So with petroleum, she was treated. One more calcarea fluid was given for her benign. But she was not better. She is taking water therapy at USA. And all they are doing, they are maintaining what the 6 factors I told you: sunlight, diet, air, exercise, rest. They are doing this. This man upstairs, Sadhuji, he will not eat food which is like cooked, uncooked food. He's taking fruits, apples, like that. He will, so absolutely no health problem is there. And she is from, this lady is from Pondicherry. And she's telling, don't take my photo. I have become old. Don't take my photo. Like that. So they all, even this two husband and wife, you will see the left side cap and this green. They are also doing very well. They are maintaining their lifestyle and only acutes are coming. They are taking mostly allopathic medicine. They are taking this lady also absolutely, and they are like 75 plus. So we can see this kind of case studies. You just see the old people around, they are more healthier than what you think and what you feel. They are able to walk. They are maintaining their lifestyle very well. Longevity, what we are talking. So these are some case studies, the people I met, and now I have developed a thought process to see people around, how they are, what they are doing, how they are living and making their life fulfilling and very well life. So conclusion is to nurture the mind, body and soul, embrace the healing touch of sunlight, wholesome food, fresh air gained from movement, restful sleep and peace found in healthy minds. Still, I want to give you one more example what this brand Johnson is doing. You all might knowing, but just this kind of research and experimentation is also going. We should just aware what the latest things are going. So tech entrepreneur and founder of Blueprint Health startup had gained attention, extreme anti-aging regimen, the lung capacity, biological ages. He has done some plasma transplantation, like he has given to his father, many experimentation this person is doing. But long-term results remain uncertain. Just you see, we don't know, like he's still doing the research. But if we see these 6 factors, I feel this sunlight, diet, air, exercise, rest, mental health, absolutely very interesting. And with some health issues, a homeopathic medicine, and if we are to the senior person, will surely it will be very much helpful. I think that's all. Like time for sleep, for good sleep for everyone. Yes, Dr. Shweta. uh, I am done with my presentation. Thanks for patient listening to all.
Thank you so much, ma'am. It was really wonderful. And homeopathy is not only good for pediatrics, but in geriatrics also. So, wonderful case presentations. And do we have any questions from the participants who have joined us today? You can unmute yourself or you can write it down, your query in the chat box. I think everything is very much clear to our participants. And any questions?
Yeah. Yes.
Moving forward, thank you, our speakers, honorable speakers, Dr. Krutik Shah and Dr. Deepa, for the wonderful session. It was really enlightening and enriched, and wonderful cases, I must say. And congratulations to both of you. We would like to take the privilege to honor our speakers with KHA Appreciation Certificate. Please accept it from KHA Homeopathy Study Group. Let me share. Congratulations to Dr. Krutik Shah. Congratulations to you too, Dr. Deepa, for this wonderful session. Thank you for your gracious presence and for your precious time,
Thank you.
sharing your knowledge and wisdom. Now let me announce the upcoming May event that is on 10th May 2025, and along with that we will also we will be celebrating our fifth anniversary, and our speaker on that day would be Dr. Frederick Schroens. He'll be speaking on a few things Kent was not able to do. So you can find the link to register at our website, kavitakhomeopathy.com, and don't miss the webinar. Thank you once again to our honorable speakers. Heartful thanks to our viewers and followers to join us today. And we will be having many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. For the upcoming webinar info or any other updates, follow our social media handles at Instagram, Twitter, Facebook, and LinkedIn. I'm thankful to CAR volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. If you have any query, reach us at carstudygroup@gmail.com, and don't miss to fill the jot form to receive your certificates. You will receive it around 10 days, within 10 days. And thank you so much for joining us today. Shall we end, Dr. Deepa? Right. Thank you so much. Good night to all of you. Bye-bye.